Hello, everyone. Thank you for joining us on this episode of BAEP Talks with a 30-minute discussion with a person of interest who has experience with living with, managing, treating, and/or supporting others with a chronic menstrual health disorder. My name is Shantae Warden, the Vice President of the Barbados Association of Endometriosis and P.C.O.S. And as you know, I'm also your new host. Today, I am joined by Dr. Satyendra Persaud, a urologist, and Dr. Persaud graduated in 2005 and finished his general surgery training in Barbados in 2010. He completed urology training at the University of the West Indies, St. Augustine in 2015, graduating with the Doctor of Medicine in Urology, and was the first graduate of the Trinidadian program. The following year, he commenced further training in the United Kingdom as part of the International Surgical Training Program of the Royal College of Surgeons of England. He completed 2 years of subspecialty training in endourology at the Bradford Royal Infirmary and Colchester Hospital. He's an expert on kidney stones. Dr. Persaud is a fellow of the Caribbean College of Surgeons and the Royal College of Surgeons of England. He's a member of the International Society of Urology, or SIU, and the American Urological Association. He served on the programs for developing World Subcommittee of the SIU Academy and currently sits on the Endourology Committee of the Academy. He's a member of the Caribbean Urological Association, where he served as organizing secretary. He has published several research papers in peer-reviewed journals and presented at numerous conferences, winning several awards in the process. His research interests are kidney stones and prostate cancer. Satyendra is a full-time lecturer in urology at the University of the West Indies and is responsible for both undergraduate and postgraduate teaching. He's based at the San Fernando General Hospital and is coordinator of the Doctor of Medicine residency program in urology. Dr. Persaud is very passionate about patient education and feels strongly about empowering patients to participate in their care. Good night, Dr. Persaud. Thank you for joining us this evening.
Hey, hi, Shante. The Barbados Association Endometriosis has done so much. People don't understand how well run you guys are. Every time I'm involved with an activity with you guys, whether it's a panel discussion or one of these talks or something, I'm always impressed by the administration and the reach of the organization and how well run it is, and how much you actually do for this small organization in Barbados, how much you've actually done, how much patient education you've managed to achieve, and how well you've actually done it. It's very, very professionally run. And I just want to congratulate you guys again. I've said the same to Julia.
Yes.
How well run this organization is. So congrats.
Thank you so much. And
I'm happy to be here.
yes, thank you for being here with us. And we truly appreciate your encouragement. We have come a long way and we still have a long way to go. But
Yeah, you can always improve.
yes, you can always improve. And with the help of doctors like yourself, helping to educate persons, we will get where we need to get eventually. Yes. So my first question to you is, we always hear about all of these specialists and stuff like that. Why would I come to see a urologist? What is it all about?
You mean with someone with endometriosis or urologist in general?
Just in general, just in general.
So urologists look after the male and female urinary tract and the male reproductive tract. So we would look after, so the female reproductive tract would be, as you know, a gynecologist. So we would look at the kidney. So you have two kidneys, they come down 2 pipes and they attach to your bladder. And then that from the bladder drains to the outside, male and female are a bit different. But we look after diseases of that system, so the urinary system. And in the males, we look after diseases of like the reproductive system, so testes, seminal vesicles. So we see male infertility, and we see, in Trinidad, a lot of kidney stones, a lot of prostate problems. But for someone specific for endometriosis, we would see you when the endometriosis starts, unfortunately, to affect the urinary tract.
Okay. Because I'm assuming many persons may think it's just the bladder that you guys may look at. So it's very interesting to hear that you also look at the reproductive system of males. That's very
Yeah,
interesting.
we
And
do look after the male reproductive tract.
okay, now we would have heard about you specializing in endourology. Can you give us a bit about what that is about?
So endourology is really like a minimally invasive. So there are different subspecialties within urology. So you have a urologist who's done general urology training, and then they go on to do, some people go on to do female urology. Like I have a colleague just came back from America. She trained in female and reconstructive urology. There's uro-oncology. Those guys specialize in cancers of the urinary tract. Endourology is a little bit of everything, but we do minimally invasive. So previously, we used to do surgeries to take out kidney stone, for instance, and unfortunately, we still see some of this even in Barbados. We cuts to take these stones out. Endourologists do everything without cuts, right? Or if we do make cuts, they are tiny cuts. So, like for a kidney stone, for instance, we can take a big stone out through a incision about yay big, which is about 1.5 centimeters probably, as opposed to this big, which is 8-9 inches. And if we're doing surgery on the kidney, we can do it through keyholes. We can do it without making any incision on the skin with lasers and so on. So that's really what endourologists do. And we, not just stones, but a wide variety of things: obstruction, urinary tract, endometriosis sometimes. Although when we see patients with endometriosis, it's usually part of a multidisciplinary team rather than just seeing a urologist.
Okay, that is great. That is great. Now we're speaking about endometriosis, and the month of awareness is coming up next month. Can you tell us what effects endometriosis can have on the bladder, on the urinary tract?
Yeah, so it's not uncommon to have endometriosis spread to the urinary tract. It's probably less than 10% overall, although the number varies widely depending on which studies you look at. So endometriosis is like an abnormal deposits of kind of like endometrial tissue, and you have it on the peritoneal surface. You can have it, at different parts of the tummy, and it causes a lot of pain. Sometimes you can have it implanting into the bladder, and you can have superficial type and you can have a deep type. So the superficial type is just on the surface, and then sometimes you can have it deeper under the surface. So you have two major types, and you can get endometriosis deposits in the bladder. You can get endometriosis deposits. The bladder is by far, like 4 out of 5 times when it affects the urinary tract, it affects the bladder. Rarely it will affect the tubes coming from the kidney to the bladder, and very, very rarely it will affect the kidneys. So that's when we get involved.
Okay, that's very interesting. Very interesting. I know we speak about endometriosis being this painful disorder, but we know there are other disorders that can cause bladder pain or issues with the bladder. Is there a difference? Can we distinguish a difference between?
So sometimes it's difficult. And first of all, sometimes endometriosis in the urinary tract, so it affects it in 2 ways. You can have extrinsic or outside and inside. So imagine for a second, you have your kidneys and you have 2 tubes coming down from your kidneys. You have endometrioma outside of the ureter. Those tubes are called the ureters, right? So you can have endometrioma, this mass of tissue like a cyst, compressing the ureter. It's not invading into the ureter, just compressing the ureter. So it blocks the ureter that way. And when it starts to block the ureter, you start to get, the kidney starts to swell, much like a stone. And if it happens gradually, which is what endometriosis is, it's a chronic disease, basically. If it happens gradually, you might not get any pain because it happens so gradually. And the way it can affect it is to actually invade the ureter. And this is more difficult because if it's outside the ureter, you can just remove that endometrioma. When it starts to invade into the tubes is when you have to remove bits and pieces of the urinary tract. It's like you have to remove a part of the tube and plug the ureter back into the bladder. But you can have, particularly here, you can have a number of things. So overactive bladder, urinary tract infections, bladder stones, something we call interstitial cystitis or painful bladder syndrome. These are all things that can mimic it. And sometimes you can't tell from the history, because the symptoms might be the same. So you have that asymptomatic bunch, and then you have the patients who will get pain with the periods. I've had patients who've had bleeding in urine with what they call catamenial bleeding with the periods. You can have painful intercourse as well with endometriosis. You can have urinary tract symptoms, so they're going to the bathroom often. And there's like a significant overlap between endometriosis to the urinary tract and all these other things, like infection, stones, painful bladder syndrome. So sometimes you have to take it further and do further investigations, you know.
Okay. Okay. Now, you spoke about UTIs, and that was one of the questions that I had for you. Are women, excuse me, are women with endometriosis at an increased risk of having recurring UTIs?
I don't see it. There might be, you know, I'm not sure the data supports that, but I don't really see it in my practice that women with endometriosis haven't presenting anymore with UTIs. They might present with UTI type symptoms, but if you test them, at least what I've seen, if you actually do the urine test and so on, you might find it's not actually UTI, you know. But when you have these, you kind of have to go through the tests. When you have these symptoms, a urinary tract microscopy is a basic investigation, and that will readily tell you if there's a UTI.
Because I for myself, I have endometriosis as well. And I find a lot of times I ask myself, is this a UTI? Like, what am I experiencing? Do you have any suggestions on what persons may be able to do if they're experiencing symptoms of a UTI?
If you're experiencing, sorry?
No, should they come to a doctor or, you know?
Yeah, I think so. But you see, the problem I have sometimes with primary care providers in particular is they'll guess the symptoms and they'll just say, oh, UTI, and just prescribe antibiotics. You should have some kind of evidence, you know, that there's at least a dipstick. You know, those dipsticks are cheap, and you put it in the urine and you can see if you have what you call nitrites and leukocytes, and you can see if there's a UTI. If you're somebody who's prone to UTI, you can get your own dipstick. I mean, it's super easy to read. It costs next. You dip it in the urine and you look at the colors and you say, oh, this might be a UTI or this is just blood. You know, and I might need to see my doctor for this. So all that sometimes what we think is a UTI, and we treat not necessarily UTIs.
Okay. And if it is not a UTI, how serious could it be?
Well, if it's not a UTI, and if your primary care provider has treated you for a UTI and it's not resolving, there are only two possibilities really. One, he's treating you or she's treating you for something that's not a UTI, and two, it is a UTI and you don't have the right antibiotics. So either of those situations, you have to do a urine test now to figure out, is this really a UTI? And when you do a urine test, you figure out, well, hey, this is growing bugs in it. After they put it on different substances and the bacteria grow, and then they can test and see what is resistant or sensitive to. If it is a UTI, then you treat it appropriately. If it's not UTI, then you need to look for some other cause. So that's where you might do some imaging. That's where you might do an ultrasound. You know, and sometimes is where you pick up these things. So I had one lady who, similar thing, was treated for UTI and didn't resolve. And then she did an ultrasound. Now, I don't know if you've ever had an ultrasound. If you're had endometriosis, you probably had an ultrasound before.
Yes.
Or several. Right?
Yes.
So what they do is they ask you to do it on a full bladder.
Yes, they do.
All right. And when they do the ultrasound, you can actually see this mass projecting into the bladder easily. And when we did, so the next step after that is bladder mass. We have to look in much like how you do a colonoscopy, similar to the bladder, except a much smaller scope. And we look into the bladder and we see this thing that looks like basically uterine tissue is purple, and almost like a cyst that's stuck in the wall. Now she opted for medical treatment, so she opted on the oral contraceptive pill, and that took care of her symptoms. But when you spoke to her, when you broke it down more in depth with her, she had this bleeding every time she had her period, blood in the urine, you know. and people would just treat her for UTIs.
But it was something more complex.
It was something else, you know, and she had endometriosis.
Okay. That is very interesting. Oftentimes, I find a lot when women say, you know, this is happening to me. A lot of doctors, they tend to, I'm guessing that this is due to the lack of education. They tend to just bypass it. They just say, okay, take medication or take antibiotics or take pain killers. But as you said, it can be something way more complex than a UTI. A UTI can be fixed with antibiotics, but you may need surgery, right?
You could potentially need surgery, yeah. I mean, you see management of the endometriosis, and then you kind of sometimes see the complications of the management. I remember one time a doctor, nonetheless, I saw in Barbados. She had laparoscopic surgery by a gynecologist to remove her endometrioma, and it was so close to her urine tubes. It actually there was a hole after they were finished that they didn't recognize, and urine continued to leak out of there. So as urologists, we kind of get involved with that as well, and that's something that can be fixed. That can be fixed. I know it sounds terrible, but you know, you put a stent in that just bypasses that blockage, and that's fixed.
So you were there, you were present there, so that in case anything happened,
No,
or it was something after?
she had it done in the UK, and by the time she came back to Barbados, this is when she started to get fever. And when they did a CT scan, they found that urine had leaked outside of the kidney. So a stent is a little plastic tube that goes through we put it in with a camera. There's no skin, and it just bypasses the kidney tube. It goes from the kidney to the bladder. So it's a little plastic tube, and that stays in there until everything's healed, and then we take it out.
Okay, and if she had not realized that, you know, something was
she would have gotten progressively more. She came in with fever. She would have gotten, and that could, you know, that could just snowball into sepsis and even death. But that's that's something that's rare.
Okay. Okay, that's very interesting. Now, if I'm gonna give a scenario, this is a real life thing, but if there's a person who diagnosed with endometriosis, before having their diagnosis, they would have been unable to urinate, right? A very young person, and things just seem to be getting worse. They had the surgery for the endo, and that part is, you know, getting better, but the bladder, she's having more and more issues with her bladder. Now she's into catheterizing. That's what you call it.
Yeah.
What would you say about that?
What surgery did she have for endometriosis?
The laparoscopic, to take out the deposits.
To take out the deposits. I mean, she would require investigation to find out why she's not peeing. So the first thing she would get is a cystoscope. So we would, and at the time of cystoscopy, would be able to examine her properly to make sure there's not an actual physical blockage. So we would look in the bladder with the camera. We would see if we see anything on the inside. And the other thing that we would do is what you call a urodynamic test if she's not peeing her bladder properly. So, and this is she tries to pee, she forces to pee, and or she doesn't get a sensation.
So she has the retention of the water in her feet and everything like that. She also was saying she had numbness in her legs as well. I'm not so sure if that is attributed to that. I'm not so sure.
So I don't know what she had, but sometimes either as a result of surgery or as a result of the process of endometriosis in itself, you can get damage to nerves adjacent to that control the bladder. So the fact that she's not getting the sensation to pass urine, she has water building up in her legs, means that this is progressive and her kidneys have started to fail and her bladder is not working properly. So what we would do for her is we would do what you call a urodynamic test. So the urodynamic test measures the pressures in the bladder. So if you fill the bladder and measures your sensation to pee, if I were to fill your bladder right now, when you reach about 250 mils, you would start to get 200, 250, you start to get sensation to pee. When you reach, you're screaming at me to stop and cursing at me, right? I suspect when you do that for her, that's not what happen. You're probably going to be able to put 6, 7, 800 over a liter in her bladder, and she probably will not feel it. And then it just builds up like a pressure cooker, and then the kidneys start to fail. And that's probably because the nervous sensation to the bladder has been damaged. So the urodynamic tester would investigate that. It would, if we put a liter in her bladder, she's not getting sensation, she's unable to void, she can't generate pressures in her bladder. So you're supposed to create pressure in your bladder to pee. If you're not able to generate those pressures, it means that something's happened to the nerve. And especially for a young person, that's probably happened as a result of the endometriosis.
Yes, because she would have had these
what's going on outside the bladder.
Yeah, she would have had these issues before having surgery to have the actual diagnosis. I was hospitalized many times because of the lack of being able to, pass urine. So would you say that they're at the hospital? I know it can be expensive. Living with endometriosis, having to go to all these specialists can be very expensive. Would you have any suggestions as to where a person may be able to go in the public setting?
Unfortunately, urodynamics is not available in the public sector in Barbados, to the best of my knowledge, and there might only be one provider who does it on the island. If I'm wrong, I stand corrected. Even in Trinidad, it is available in the public sector. We do it at San Fernando. The machine is just down at the moment for some disposables, the consumables, catheters, and so on. But we can do it. We do have a very good urodynamic suite here in the public sector. But in Barbados, I'm not sure it's available in the public sector. Intermittent catheterization is actually a very, very good option for her. The most minimally invasive thing. You just put a catheter in. For those who don't know, it's a small catheter. It's not a long one. It's a small catheter, and it's self-lubricating. Or you can put a little bit of lube on it, and you just pass the catheter. You have to have good hand function. You pass it about 4 or 5, 6 times a day sometimes, drain the urine, and that protects the kidneys. So that prevents the urine from building up and damaging your kidneys, which I suspect is what happened to her. Once it reaches that stage, sometimes it's difficult to actually, the bladder function never gets back to normal. Unfortunately.
Yes, unfortunately. I heard you speak about the fact that the nerves in the bladder could be damaged. Would endometriosis growing on your bladder cause nerves to have pain in your nerves running down your legs?
No, that is something that's going on in her spine, and if they haven't done already, the other thing they would probably suggest, and she's probably had this, is an MRI. So there's a cystoscopy in urodynamics and an MRI of the from where you're telling me with pain going down the leg, an MRI of the spine.
Okay, because I'm also asking for myself, because I was experiencing pain down my leg before I had surgery, and when the doctor went in, he would have stated before, where he thinks the deposits may be. But when he went in, he found the other places as well. So the bladder was included. Just on the surface, as you said, there's a surface, and then there's the deep infiltrating one. So I was just since having surgery, I have not had that pain. So I'm just trying to figure out if it was from that, if it was probably from some other space that it was found.
Perhaps it was where it was. But for this young lady you're talking about, she getting pain down her legs and so on. It's very well worth it to do an MRI of her thoracolumbar spine, or from the lower thorax and down, to see if there's nerve compression that's causing this.
Okay, well, I'm sure that this information will be very helpful to her. Hopefully there's some, help that can be provided within the public sector for years to come, because I'm sure there are many women who go through things that I probably would have described, and not knowing that it could cause bigger issues in the long run.
Yeah.
Doctor,
Endometriosis is painful. I mean, it's a terrible thing, And as you said, there's so much you have to go through. You have to do tests. You have to go see specialists. Some of these things aren't available in the public sector, or if they are, the waiting time is just so long. I understand. I get that. I understand.
Yes, it truly is. And
I hope other people understand this.
Yes, hearing it from you as a male saying, yes, it's very painful. it really means a lot, and I'm sure it will mean a lot to persons who will tune in and watch our episode. Now, Dr. Persaud, I want to thank you for joining us on this episode of BAEP Talks with, and we look forward to having you again. I really enjoyed our
Yeah,
conversation.
the time flew by so quickly. I never
Yes, it did.
a half an hour has gone by.
Yes,
But I
it had.
also say everybody, it's like me and kidney stones, you know. Everybody says they're focused on cancer, and everybody says kidney stones are not a priority until they get a stone. You know, they're just,
Yes,
"Oh, it's just a painful period. So what? You don't
yeah.
understand how painful it is.
Who feels it most? Thank you, guys, for joining
Take
us
care.
on this episode of BAEP Talks with, and we'll see you next time. Bye.
Bye bye.